Asthma. Asthma overview. Asthma symptoms, which include coughing, wheezing, and chest tightness, are common in an asthma. Sometimes asthma is named asthma or reactive airway disease. Asthma are often controlled with proper treatment. Asthma symptoms and signs. What does asthma feel like? Asthma is characterized by inflammation of the bronchial tubes with increased production of sticky secretions inside the tubes. People with asthma experience symptoms when the airways tighten, inflame, or fill with mucus. Common asthma symptoms include coughing, especially in the dark, wheezing, shortness of breath, chest tightness, pain, or pressure. Still, not everyone with asthma has an equivalent symptoms within the same way. You'll not have all of those symptoms, otherwise you may have different symptoms at different times. Your asthma symptoms can also vary from one asthma to subsequent, being mild during one and severe during another. Some people with asthma may choose extended periods without having any symptoms, interrupted by periodic worsening of their symptoms called asthma attacks. Others may need asthma symptoms a day. Additionally, some people may only have asthma during exercise, or asthma with viral infections like colds. Mild asthma attacks are generally more common. Usually, the airways open up within a couple of minutes to a couple of hours. Severe attacks are less common but last longer and need immediate medical help. It's important to acknowledge and treat even mild asthma symptoms to assist you prevent severe episodes and keep asthma under better control. Know the first symptoms of asthma. Early warning signs are changes that happen just before or at the very beginning of an asthma. These signs may start before the well-known symptoms of asthma and are the earliest signs that your asthma is worsening. In general, these signs aren't severe enough to prevent you from going about your daily activities. But by recognizing these signs, you'll stop an asthma or prevent one from getting worse. Early warning signs of an asthma include frequent cough, especially in the dark, losing your breath easily or shortness of breath, feeling very tired or weak when exercising, wheezing or coughing after exercise, feeling tired, easily upset, grouchy, or moody. Decreases or changes in lung function as measured on a peak flow meter. Signs of a chilly or allergies, sneezing, runny nose, cough, nasal congestion, pharyngitis, and headache. Trouble sleeping. If you've got these warning signs, adjust your medication, as described in your asthma action plan. Know the symptoms of an asthma. An asthma is the episode during which bands of muscle surrounding the airways are triggered to tighten. This tightening is named bronchospasm. During the attack, the liner of the airways becomes swollen or inflamed and therefore the cells lining the airways produce more and thicker mucus than normal. All of those factors, bronchospasm, inflammation, and mucus production, cause symptoms like difficulty breathing, wheezing, coughing, shortness of breath, and difficulty performing normal daily activities. Other symptoms of an asthma include severe wheezing when breathing both in and out, coughing that will not stop, very rapid breathing, chest pain or pressure, tightened neck and chest muscles, called retractions, difficulty talking, feelings of hysteria or panic, pale, sweaty face, blue lips or fingernails. The severity of an asthma can escalate rapidly, so it is vital to treat these asthma symptoms immediately once you recognize them. Without immediate treatment, like together with your asthma inhaler or bronchodilator, your breathing will become more labored. If you employ a peak flow meter at this point, the reading will probably be but 50%. Many asthma action plans suggest interventions starting at 80% of normal. As your lungs still tighten, you'll be unable to use the height flow meter in the least. Gradually, your lungs will tighten so there's not enough air movement to supply wheezing. You would like to be transported to a hospital immediately. Unfortunately, some people interpret the disappearance of wheezing as a symbol of improvement and fail to urge prompt emergency care. If you are doing not receive adequate asthma treatment, you'll eventually be unable to talk and can develop a bluish coloring around your lips. This color change, referred to as cyanosis, means you've got less and fewer oxygen in your blood. Without aggressive treatment for this asthma emergency, you'll lose consciousness and eventually die. If you're experiencing an asthma, follow the red zone or emergency instructions in your asthma action plan immediately. These symptoms occur in life-threatening asthma attacks. You would like medical attention directly. Know the asthma symptoms in children. Asthma affects as many as 10% to 12% of youngsters within the US and is the leading explanation for chronic illness in children. For unknown reasons, the incidence of asthma in children is steadily increasing. While asthma symptoms can begin at any age, most youngsters have their first asthma symptoms by age 5. Not all children with asthma wheeze. Chronic coughing with asthma could also be the sole obvious sign, and a child's asthma may go unrecognized if the cough is attributed to recurrent bronchitis. Know about unusual asthma symptoms. Not everyone with asthma has the standard symptoms of cough, wheezing, and shortness of breath. Sometimes individuals have unusual asthma symptoms which will not appear to be associated with asthma. Some unusual asthma symptoms may include the following: rapid breathing, sighing, fatigue, inability to exercise properly, called exercise-induced asthma, difficulty sleeping or nighttime asthma, anxiety, chronic cough without wheezing. Also, asthma symptoms are often mimicked by other conditions like bronchitis, vocal fold dysfunction, and even coronary failure. It's important to understand your body. Talk together with your asthma doctor ETAL with asthma. Be aware that asthma might not always have an equivalent symptoms in everyone. Know why infections trigger asthma symptoms. Sometimes an epidemic or bacterial infection is an asthma trigger. For instance, you would possibly have a chili virus that triggers your asthma symptoms. Or your asthma are often triggered by a bacterial sinus infection. Sinusitis with asthma is common. It's important to understand the signs and symptoms of tract infections and to call your healthcare provider immediately for diagnosis and treatment. For instance, you would possibly have symptoms of increased shortness of breath, difficulty breathing, or wheezing with a bronchial infection. In people that don't have asthma, the bronchial infection might not trigger an equivalent debilitating symptoms. Know your body and understand warning signs that an infection could be starting. Then take the right medications as prescribed to eliminate the infection and regain control of your asthma and health.
Don't forget to subscribe, activate the liking bell, and share.